hear this term, pre-diabetic, prediabetes. What does that mean to be pre-diabetic?
It means that your blood sugars or evaluation of the glucose in your system doesn't fit really the criteria to be fully diabetic, but you are not normal either.
Normally, our bodies produce a hormone called insulin to help control blood sugar. For the 79 million Americans who fall into this borderline diabetic category, that system doesn't work properly, either not making enough insulin after eating or not responding to insulin as it should. This is important because prediabetes makes you more likely to have heart disease or a stroke. Will the person with prediabetes have any symptoms at all? I mean, can you tell,
No.
hey, I've got prediabetes without a blood test?
No, unfortunately you cannot tell yourself. But if you look at your family, maybe if you have a family history of diabetes, for example, you might be suspicious that you might have prediabetes or a risk to develop diabetes. But yourself, you won't feel any different.
Who should be tested?
Definitely everyone who's older than 45, who has a BMI more than 25, or a family history of diabetes, or they have hypertension, they have a cholesterol problem, or they develop diabetes during pregnancy, or delivered a large baby, or they belong to some ethnic group like African Americans, Asian Americans, Indian Americans.
The same blood tests that diagnose diabetes are used to find prediabetes. There's the fasting plasma glucose test, where patients cannot eat for 8 hours beforehand. Results are interpreted as normal if blood sugar is less than 100, pre-diabetic if blood sugar is 100 to 125, and diabetic if blood sugar is 126 or higher. If you get a pre-diabetic diagnosis, don't panic.
I think the news is bad and good. Bad because they have a risk to develop diabetes in the future. Bad because they are high risk to have heart disease. Good because they have a second chance.
Lifestyle changes can prevent many people with prediabetes from developing diabetes or can delay onset of the disease. If you're overweight, losing as little as 5 to 10% of your body weight can make a difference. Getting 30 minutes of exercise 5 days a week also prevents and helps to manage diabetes. Nutrition is important too. Favor low-fat foods, proteins, vegetables, and whole grains, but limit sugar and starchy carbs. Which diet is the best diet to prevent diabetes?
Mediterranean diet seems to be the best diet.
I love that because the Mediterranean diet is the best for heart health too. For Fox 8, I'm Dr. Marc.
Dr. Marc is sponsored by the Cleveland Clinic.